Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Hi, welcome to DocTalk. I'm Brent Leavitt with Battleborn Financial Advisor. And we're here joined today with Levi with Spring Mountain Medical. I know Levi's actually not a physician here, but he represents a team of primary care and chiropractic doctors here in town. Just to give you a background about our show too, we're here talking about primary care in town of Pahrump and helping people get to know the doctors and the facilities that are here. Battleborn Financial Advisor and Health Insurance Brokerage, we help people with managing their money and also with managing their health care, especially if you're individual or on Medicare. My number's on the bottom of the screen. Please call my office and schedule an appointment. We also have on our website now, battlebornfinancialadvisor.com. We now have the ability to book appointments online and also get to know what services and stuff are available to you without actually having to call in, and you can do everything on your phone, on the tablet, and we can even do virtual meetings with you. So I'm going to introduce you here today. Here's Levi. And I want to talk about Spring Mountain Medical. That's the first part of the episode today about who are the doctors, kind of a little bit about the plans they take and things like that. And then I want to take the second part of the segment, and we're going to talk a little about how Spring Mountain Medical is doing things a little bit different than everybody else in town with physical medicine, things like that.
Perfect.
So tell us about who are the doctors that are at Spring Mountain and what things are you guys doing?
Absolutely. So Spring Mountain Medical, it's kind of a first of its kind, fully integrated clinic. So we have primary care, chiropractic care, all those things that you talked about, rehabilitative medicine, medical massage, you name it. So we have two medical doctors in the building with Dr. Robertson, who's our medical director. Been practicing over 20 years, came down from Texas, fantastic physician. And then Dr. Hayes, who's been in the community for a number of years, came over from another practice before. And then we have our chiropractors, which are Dr. Taylor, who's been in Pahrump for 17 plus years with Affiliated Chiropractic, just a fantastic guy. Dr. Griffith, also been here for about 3 years as well too. Dr. Rubin, which we've brought on here recently, he was fantastic. Been a chiro for 40 plus years. This guy, he's got amazing hands there. And then Dr. Stuckel as well. So we have a great group there. We also have an athletic trainer in-house and a great staff that just really focuses on your overall wellness and health.
Yeah. You guys take a myriad of insurances too, like Health Plan Nevada, you guys take all the Anthems, you take all the P3 plans, which is phenomenal. And I mean, you can even get some plans like the P3 plans, a zero copay, and you can get physical medicine taken care of.
Absolutely.
You can see your primary care doctor. And then appointment times. I know that's the biggest complaint I hear about is I can't see my doctor. It's a pain in my butt to do that. How long is usually a wait time to get in to see your doctor over there at Medical?
We're very, very passionate about giving healthcare the way you've always imagined it. It's kind of our little tagline. And that means having same-day appointment availability. Many times, either to be same day or next day. We keep appointments blocked out for special walk-ins or situations to be able to get in. If you just call our office, 9 out of 10 times we can get something squeezed in for you, because we know, listen, like getting sick, being in pain, that doesn't always happen in a convenient time for you. Yeah, you need to get in and see your physician.
Now, what's your phone number?
Yep, it's 775-727-8900.
And they're located, if you don't know, they're on the location off of Postal Road and the 160. The thing I always find weird, though, is your address says 160 on it, but you're not on 160 at all. It's the weirdest address I've ever seen, but it's actually on Postal Road.
Correct.
Right there, Postal Road is where the main post office is.
Correct.
So it's like, and you kind of like turn on Postal, and it's hard to miss this big building that says Spring Mountain Medical.
For sure.
But it's always the funny thing. Every time I look at a directory, I'm like, is this right? I mean, this is so weird. Is this the right place?
It really it is kind of funny, and we get that a lot for sure. It is a 160 address, but it is, we have 9,000 square feet facility there, and it's a big building, hard to miss, right across from the car wash on Postal Road. Yeah.
And you guys, I mean, the coolest thing about them is they really are looking at things a little bit differently. They want to make sure you're taken care of quickly. I don't think I've ever had a patient even complain once about, there's always talk about how what's wonderful and you're changing things in the medical field. And I think this is kind of unique. And we were talking earlier about the fact that everything's really billed under medical. And so even like seeing your chiropractor, which a lot of times medical insurance doesn't really like chiropractors very much in general.
Certainly.
It's always tough because, but you guys have been able to combine that with the medical things and be able to bring in a new concept of getting checked out.
Absolutely.
Making sure that your joints work and that your body's feeling healthy and things like that. Now your patients, stuff like that, do you mostly see people like, do you mostly Medicare population? Do you see younger people? In physical medicine, sometimes like people think, oh, that's for the young people, the athletes and stuff. Is that true?
No, absolutely not. We have a great demographic mix from all the different payers, from Medicaid, Medicare to Anthem to you name it, to Health Plan Nevada, and same with the ages. We talk a lot about certain things, and our doctors have different mantras. One of them is, we say it all the time, kind of upper cross, lower cross, and elderly stability. So we actually have a lot of elderly clients that are patients that are focused on just feeling better. And it's amazing what doing some of the things with the body can do. And again, I'm not a doctor, but they break things down in a way that is just very easy to understand. And you think about one of the easiest ways that I understood it, one of Dr. Stuckel was telling me, you think of the body, it's kind of like a seesaw, right? And if you've got two people on a seesaw and one is doing more work than the other, at some point it kind of gets out of balance, and your body is a lot of that way. And so a number of the things that they do really just focus on your overall health. And how we do that with the chiropractic care is 100% of our patients are actually seen by our medical doctor. The medical doctor does the actual evaluation and then puts together a treatment plan to help be able to get you to feel better. Right? Sometimes you just got to kind of trick your body into feeling better. It's not about just taking a bunch of pills. It's about how do you feel better and get into a better position with your body and your health and your immune system.
And what else are you, besides we talked about a little bit about feeling immune system, things like that, I'm trying to think of what else is important for our people to know about Spring Mountain Medical, and why is it important to book an appointment with you guys?
Very good.
Phone number there.
Yeah, absolutely. So again, like our tagline, healthcare the way you've always imagined it, and it really is. It's when you come in through our doors, it's a culture, and I think you feel it different than you go into any other medical office. The patients enjoy coming in. The staff are friendly. They're always greeting you with a smile. We understand you don't go to the doctor like you would go to the amusement park, right? You're in pain or you're sick. And so we want to be there for you. And that really shines through in our staff and our doctors. We're there to help make you feel better. So it's just a unique way of doing it. We focus on running on time. Your time is as valuable as our physicians and any of ours. We keep those appointment times open for you to be able to get in. We have, again, just a fantastic staff all the way down, from the triage person all the way up to our medical doctors that are just focused on making you feel better. It's about you, not us, and I think that comes out in how we run our clinic.
Right now we're in the middle of a pandemic, the COVID-19 stuff.
Certainly.
And we talked the last time is that people are really kind of afraid to go in and see their doctor because number one, is it safe to go to my doctor? Is it not safe? Why do I want to do that? And so people are more apt to, I want to stay home, and even if I'm feeling kind of sick, I'll just deal with it and get over it.
Certainly.
How safe is it to go to your practice right now? Is it something that's super safe? Is it something that you're worried about?
Yeah, no. So there's two things to that. One, somebody should never just say, like, I hope it gets better, right? You never know what's going on in your body. And that's one of the sad things that has occurred with the COVID-19 is a lot of people that should have sought treatment have not, right? So we have a couple of avenues available. One, we do also have telemedicine available. So we do telemedicine appointments all day long where you can actually just call the doc or the doc calls you and they do an appointment to make sure that you're okay and then can advise you based off of that.
How do you schedule that? Do you have to call in to schedule it?
Yep, call into the office and just let them know you need a telemedicine appointment. We can get you a same-day telemedicine appointment with one of our physicians, and they can then just at least do that assessment over the phone and be able to tell if they need to further something or if you need a prescription to get called in. Or they may say, hey, look, you probably need to be seen in the office. So it's always a good idea to check with the doctor and not just assume. Okay. But then as far as on the visits, Yes, it's definitely safe. We take all the precautions that were issued out from the CDC, State of Nevada, OSHA, all those things. 100% of our staff are wearing masks each time. We do a temperature check for every patient that comes in a screening process. We have also spaced our appointments out to allow for the proper number of people in our building at all times. And our physicians wear the masks as well too. So it's, and we've had an elevated cleaning system. So it's definitely safe. Obviously, if you're one of those that are at a high risk, we recommend the telemedicine appointments. But we're very comfortable with the measures that we've taken to make sure that all of our patients, employees, and family members are safe.
With physical medicine, I mean, you're touching and you're having to do some stuff. So telemedicine sometimes isn't always what we want to do. You want to make sure you guys are more of a, you need to be in there, but it's perfectly safe to do.
Absolutely.
And especially when we're at home, we're sitting at home just kind of doing nothing. Whatever it is, and your aches, your joints start to ache, things about your body just doesn't feel very good. And I think mentally your depression kind of sits in and things like that. And it's important to be able to go out and say, hey, I need to get adjusted maybe, or be able to get that all-around care to make sure that you're being taken care of.
Absolutely.
Now, do your doctors, like Dr. Hayes and Dr. Roberson, those are your primary care doctors, do they do anything with like kind of mental health stuff as well, or is it mostly just all in the physical medicine?
Yeah, in primary care, we were having a conversation with about this just the other day. It really is all-encompassing. Somebody's stomach problems could be leading to their anxiety issues, right? And those types of things. And primary care really encompasses that all together. And a compassionate doctor that will sit and listen to all of those things. He or she may not be able to address all of it right there, but they're kind of that focal point to then say, all right, hey, let's get you to see somebody over here, let's refer you to over here. But they're kind of that control point or that quarterback, right, in that care plan. So.
And it's all in one place too, so you're not trying to go to like one building to another building to another building. It's just across the hall and trying to make sure everything's taken care of.
Absolutely.
So what I want to do is we're gonna leeway in a little bit to our next segment, which we're going to come back from a break. I want to talk a little bit more about kind of like when somebody walks into your office, what it's going to be like to walk in the office, what kind of thing you're going to expect as a new patient, and then how that's going to go forward into the physical care and how to get better and things like that. I'm going to go ahead and also we're going to go to break, and then we're going to talk coming back with it. Again, I'm put on the screen here. We're with Levi with Spring Mountain Medical. That's their phone number right there on the bottom of the screen. Give them a call, schedule an appointment, get to know them. They'll get you in. They'll even do telemedicine appointments, things like that with you. They're located off of Postal Road and the 160. Ignore the 160 address they have. It is actually on Postal Road. They're up the street on the right-hand side. Thanks so much, and we'll talk to you in a minute.
We will return with more Doc Talk after these messages. Welcome to Doc Talk with your host, Brent Leavitt. And Doc Talk with Brent is sponsored by Battleborn Financial.
Welcome back to Doc Talk. This is Brent Leavitt. I'm the owner of Battleborn Financial Advisor and Health Insurance Brokerage here in Pahrump. We are joined again today with Levi with Spring Mountain Medical, and we're talking a little bit about how physical medicine is changing a little bit of the care here we have in Pahrump. And again, Battleborn Financial, we're here to help you out with your health insurance needs, whether you're an individually on Medicare. Now, we're also financial advisors there too. We help people manage money and their health. So it's more about trying to make sure that we're looking at your whole entire needs, whether it be your financial needs and also your medical needs. And we're helping pair you with some of the primary care doctors here in town to get to know them, who they are. And so that way, when you're choosing your doctor, you at least get to know who they are before. Oftentimes, I know that we come into town, we just pick somebody off our list and say they look great, and they see them, and then they don't realize what kind of opportunity they're going to have or what it's going to be like when they go in the office. The purpose of the show is to make sure that we know who they are and get a chance of understanding what it's like to be a patient of that facility. Levi I want to have a talk a little bit on the segment. We talked about what it's like to be a new patient and what kind of care you're going to get. I think Spring Mountain Medical is a little bit different in the way that they pair this whole idea of chiropractic care and primary care all in the model, and they bill it under the medical services. So that way, the primary care doctor is always the quarterback, making sure everything's done correctly and that you're being taken care of in a good way. And then the chiropractors are there to make sure that your body is working the right way that it should. And they kind of merge the two together. They have two primary care doctors here. They have Dr. Hayes and Dr. Roberson are the main MDs that are in the practice. And a lot of people know Dr. Hayes because he lives here in town. He's been working here for a long time. And then Dr. Roberson, they pulled him all the way from Texas to try to make sure that they had to get really good care of him prompt as well. And they wanted to bring somebody else from outside to bring it in and help our cool little town here. And then they have 4 different chiropractors. Everybody, I think, when the first thing I knew here was everybody said Doc Taylor. That's like the name that everybody knows.
Absolutely.
He's been here like forever. He's been in a whole bunch of different practices and practicing on his own. And he's such a really good guy. Like I know him personally and just wonderful, wonderful personality. And then we have Dr. Griffith, who actually is one of the owners of the practice, and he's been practicing. He's been with us about 3 years now, he said.
Correct, yeah.
And then we have the other 2, I can't remember their names again.
So Dr. Stuckel, and Dr. Stuckel, he's actually one of the only state of Nevada sports diplomates as well too. This guy is one of the smartest doctors you'll ever run into. This guy just understands the human body like nothing. And then Dr. Rubin. Dr. Rubin's been a chiropractor for over 40 years. And just loves Prump. He's just fallen in love with it, the people, all of it. And so we have a great group. And then we also have Dr. Planta that does come in as well and helps out. And she's been here in the community for quite some time.
And Dr. Planta does what again?
Chiropractic as well.
Chiropractic as well, okay. Now tell me, so I mentioned we'll go back and say, so when somebody new, a patient comes in, I want to say, I want to go to Spring Mountain Medical.
Yeah.
What's the process going to be like when they call in and say, I'm a new patient, I don't know anything, I just want to establish care, whatever it is.
For sure. Well, I kind of like the way you explained Battleborn Financial as well, right? To kind of the all-encompassing, help your, take a look at your whole financial picture. We think of it the same way, but on your health picture, right? So a new patient that would call, sets up a new patient appointment, speaks to our scheduler on the phone. She'll get you scheduled for that appointment. What you should expect when you come in, we usually say, hey, show up, 15, 20 minutes early so we can do some of the intake paperwork. We're also completely paperless, so it's all done on an iPad. It's really nice, quick, couple little clicks to go through, make sure that your medical history and all that stuff is updated and current within there. And then from there, you then get taken into the triage where you're actually take your vitals, do those things, and then you're placed into the room to see the medical doctor. Medical doctor will then talk about, your chief complaints, things that are going on, checks your systems, your bodies. They perform different tests to see how your musculoskeletal system is working, and kind of just takes a look based off of that. Then from there, we'll help kind of develop the plan of, and it's not just chiropractic. For me, when I knew before I joined this practice, when I thought chiropractic, it was the, hey, come in, rack 'em, crack 'em type of thing, right? Which there's still that and does exist. But with Spring Mountain Medical, it's far more than that. We have different therapeutic exercises. We have different machines. We have, hands-on massage. You have a number of different active and passive therapies, depending on what the doctor prescribes. Then he places you over with the other appropriate physician or staff member, and they execute that plan depending on what your body needs. And they do a fantastic job. They're all very passionate about what they do, and it's amazing what you see. And you can definitely see the mood change of the patients. When they come in, they're in pain, they're hunched over, they've been having back, neck, headaches, sinus problems, all sorts of things. It's amazing what getting the human body back in the right positions and in the right areas does for your entire system. And so, that's really what to expect. You'll be greeted with a smile, and you'll leave with a smile. And that's kind of really what we focus on.
It sounds like a really long appointment to me. Is it a long meeting? Is it
no,
an hour? Is it
it really isn't. Again, we're very efficient on how we go about it. That's why we want to make sure the patients show up on time, because we're going to stay on time as well too. And it kind of is like a little fine-tuned machine with each area and everybody knowing what their role is. And then we have a quarterback on the floor. His name is Cameron. That just kind of really makes sure everybody's in the right spot at the right time. So your new patient appointment, I would expect about an hour. But if you're in the building too much longer than that, then we
Some places I sit in the waiting room for an hour just waiting to be seen for like 5 minutes and 10
Yeah.
minutes. I'm actually going to be, that's the coolest thing right now. It's like, I hate going to the doctor just for that purpose. It's like, why do I have to wait around forever for you?
Correct.
And a lot of people don't realize that's why in Pahrump we have everybody complains we have, primary care, this and that. Like we have some great doctors here in town, and it's actually easy to get into them, and they really do respect a lot more of our time because they understand that we got a place to go and things to do.
And our doctors really understand. That's one of the reasons why we wanted to bring Dr. Robertson down from Texas. Really understand rural health, right? Pahrump is not Las Vegas. Pahrump is not New York City or California. It's different, and the patients deserve to be treated that way. And so you want a physician that understands rural health, that understands the mindset out here and the needs of the patients out here. And all of our physicians really do, and put that at the forefront of their treatment and how we treat our patient from start to finish.
Yeah, that's awesome. Now I talked a little bit about the need of the patient coming in and things like that. What kind of care, as we go on and become established patients, the biggest thing I know a lot of people, they talk about their pain medications. There are a lot of them are on a lot of pain meds. It's the hydrocodones and things like that. And the biggest frustration people get is the fact that in the state of Nevada has put in extra little things in there the last couple of years that made it so you can't even get those pain meds anymore.
For sure.
And we've had this big thing with the opioid pandemic, things like that. We're just dealing with that kind of stuff.
Absolutely.
But I think with chiropractic care, people don't realize that our goal is to get you out of pain.
Absolutely.
And so you don't have to worry about those medications and things like that. In our last episodes, we talked a little about health and making sure you're healthy in our bodies and things like that, and the fact that we can lose weight and we can make sure that we're not going to have heart disease and chronic conditions.
Certainly.
Pain is a big chronic condition that we have, and I think your practice focuses more on pain. Would that be a correct statement to say?
Yeah, no, it definitely does, and we have a number of different things that we do to, again, help the patient experience with all of that. One, we bring in a couple specialists monthly as well, too. So we also have a pain management group that comes out that can help manage the prescriptions that you are on, to make sure that that you're on the right ones and not doubling up on ones that you don't need to, right?
What's the name? What's this group that comes out?
It's called Pain Matters. So they come out, and they come out every other week right now, and you can see them. They sit down with you. They do a fantastic job of managing the pain meds that may have been prescribed to you, any controlled substance, and they're a fantastic group at what they do, and helps peel that down, right? And then we also have a neurologist group that comes out at least once a month and sees patients out of our clinic, so then that way they don't have to drive into Las Vegas for those initial consultations. And that's, Dr. Logan Dowds that comes out and does those things. So we're bringing services into Pahrump to help reduce the pain, because again, if you're in pain, last thing you want to do is have to sit in a car for however long to get into Vegas and then sit through those appointments. We really focus on that overall, again, feeling better, right? So if we can take and get you on one less of those pills, right, then that's progress. And it's that little bit of progress each step of the way to help getting you to live a pain-free life, or at least as close to possible as you can. Some of our bodies have been through more than others, right? And but if we can just reduce that just a little bit and get you feeling better on your own, that's really what our clinic focuses on.
The neurologist and the pain management doctor, do you guys schedule those appointments yourselves, or are they all scheduled with those doctors individually?
They are scheduled with those doctors individually. You can call our office, though, and we can connect you to their schedulers as well. They're separate clinics, separate doctors, but they handle their appointments. You're more than welcome to call into ours, and we can get you their number, or we can forward you right over to their scheduling department.
How do they work with other insurances? Like, are they contracted with the same companies you guys contract with? Do they have some not overlapping things and things like that? What's also
I would say the majority are the same as us. They may have a few extras, to be honest with you, because they also operate pretty heavily in Las Vegas as well. But they're fantastic at what they do. So typically, if it's an insurance that we accept, it's usually one that they do, and we can work with our referral specialist and within our office to obviously make sure of that ahead of time for you.
Yeah. So you guys have actually somebody in your office that's taking care of all that stuff for them.
Absolutely, yeah.
It's
Correct, yeah. So when you see one of our physicians and there needs to be a referral out, they all go to a single point in our office, and she handles the initial contact, making sure the insurance is good, everything is set, and then they reach out to schedule that appointment for you.
And how do you guys manage like chronic care, like people with chronic conditions such as diabetes, heart control, things like that?
Absolutely.
Do you guys have a case manager that helps manage that as well, or is it something in the office, or is that something the primary care doctor
it's kind of up to the primary care doctor, because again, they're really that quarterback, and they know the patient far more than a case manager or a person that may just be sitting behind a computer and looking at numbers and things like that, right? They have the real time, personable relationship with each of those patients, so they may know, hey, you know what, this is really what they need, versus what some computer program might spit out and say, well, this is what we think they need.
Yeah. I've been wanting to say this, and I'm just going to say it on this channel, but one thing cool about Spring Mountain Medical is couple of the plans they take, they actually can get some of your insulins and some of your other important medications actually at no cost. That's one thing I have to call my office to learn more about that, but those are the coolest thing they have there, and they really work with you. Our time is up today. Just want to put up our Battleborn Financial Advisor and also Spring Mountain Medical. Want to say thank you for them coming out today. Physical medicine is kind of the key to the future and where things can be at. Thanks for tuning in, and we'll hopefully see you next week. We're going to meet with Dr. Eric.